Welcome to PT Microlessons, fast lessons with big impact. In this lesson, we'll review the anatomy of the cardiovascular system, including the heart, blood vessels, coronary circulation, and the cardiac conduction system. Understanding these structures provides the foundation for recognizing cardiovascular disease and applying physical therapy interventions safely and effectively. The cardiovascular system has four major components. The heart serves as the pump, generating the force needed to circulate blood. Arteries and arterioles distribute blood away from the heart. Capillaries are where oxygen, nutrients, and waste products are exchanged with the tissues. Finally, veins and venules collect blood from the periphery and return it back to the heart. The heart sits within the mediastinum, the central compartment of the thoracic cavity. Because it functions as both a mechanical pump and an electrical organ, we'll briefly review its layers, chambers, valves, coronary blood supply, and conduction system. Let's review the layers surrounding the heart from the inside outward. The endocardium is the thin inner lining that covers the heart chambers and valves. Next is the myocardium, the thick muscular layer responsible for generating the force of contraction. The outer layer of the heart is the epicardium, also called the visceral pericardium. Between the visceral and parietal layers is the pericardial cavity, which contains a small amount of lubricating fluid to reduce friction as the heart beats. Finally, the parietal and fibrous pericardium form the tough outer covering that protects and anchors the heart within the thorax. Next, we will look at the heart's four chambers. The right atrium and right ventricle receive deoxygenated blood returning from the body and pump it to the lungs for oxygenation. The left atrium and left ventricle receive oxygenated blood from the lungs and pump it through the systemic circulation to supply the body's tissues. Blood flows through two atrioventricular or AV valves. The tricuspid valve sits between the right atrium and right ventricle, while the mitral or bicuspid valve lies between the left atrium and left ventricle. During ventricular contraction, these valves close to prevent blood from flowing backward into the atria. The heart also contains two semilunar valves. The pulmonary valve prevents blood from flowing backward from the pulmonary artery into the right ventricle, while the aortic valve prevents blood from returning from the aorta into the left ventricle. Together, the heart valves ensure that blood moves in only one direction. Now for a key point. Clinically, normal heart sounds are produced by the closing of the heart valves. S1, often remembered as lub, occurs when the atrioventricular valves close at the beginning of ventricular contraction. S2, or dub, occurs when the semilunar valves close as ventricular relaxation begins. Let's put everything together by following the path of blood through the heart. Deoxygenated blood enters the right atrium through the superior and inferior vena cava. Then it passes through the tricuspid valve into the right ventricle, then pumped through the pulmonary semilunar valve into the pulmonary arteries and reaches the lungs. After becoming oxygenated, blood moves from the lungs to the heart via the pulmonary veins into the left atrium. It then passes through the mitral valve into the left ventricle, where it is ejected through the aortic semilunar valve into the aorta. Although blood fills the heart chambers, it does not directly nourish the heart muscle. Instead, the myocardium receives oxygen and nutrients through the right and left coronary arteries, which branch from the base of the aorta. When these arteries become narrowed or blocked, the myocardium may become ischemic, leading to angina or myocardial infarction. The heartbeat begins in the SA node, the heart's natural pacemaker. The electrical impulse then travels to the AV node, where it briefly pauses before continuing through the bundle of His, the right and left bundle branches, and finally the Purkinje fibers. This coordinated electrical pathway ensures that atrial contraction occurs before ventricular contraction, maximizing cardiac efficiency. Now that we've covered the heart as the pump, let's look at the distribution system, consisting of the arteries and arterioles. Blood leaves the heart through the large arteries, then branches into progressively smaller arteries and arterioles. Arterioles contain a thick layer of smooth muscle, allowing them to constrict or dilate and regulate blood flow to different tissues. Because of this, arterioles are the primary site of peripheral vascular resistance and play an important role in blood pressure regulation. After passing through the arterioles, blood enters the capillaries, the smallest blood vessels in the body. Capillaries measure only about 0.01 millimeters in diameter. Their walls consist of a single layer of simple squamous cells, allowing efficient exchange of oxygen, carbon dioxide, nutrients, and waste products. Blood flows slowly through the capillaries, and red blood cells often pass through one at a time, maximizing diffusion. After gas exchange occurs in the capillaries, blood begins its journey back to the heart. Veins return blood to the heart and operate under much lower pressure than arteries. Because venous pressure is low, venous return depends heavily on the skeletal muscle pump, especially in the lower extremities. One-way valves prevent blood from flowing backward and help reduce pooling. Veins also serve as capacitance vessels, storing about 65% of the body's blood volume at rest. Central venous pressure averages about 5 millimeters of mercury, while venous pressure in the lower extremities can approach 50 millimeters of mercury when standing. This highlights the importance of the skeletal muscle pump during walking.
That's it for this PT Microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.